now. I don't want the message going out from here to be anything else other than our intention is to keep schools open as long as we can for a number of reasons. One, we don't currently see real epidemiological value to closing schools in a widespread way. Number two, those schools are educating the children of our first responders, of our healthcare providers, of people in our community, and closing schools has tremendous carry-on effects, and we want to be careful about that. And number three, we think that we can manage risk, and we know that children are dealing with this virus really remarkably well. We don't know exactly why, but when you look at the serious illness and the mortality rates coming out of China, there are virtually no children who are being seriously affected. So those are all factoring in, as Bob said. It is a fluid situation, but our intention right now, and I've been in touch with health officers in other parts of the state as well as the state health department, our intention in Gallatin County is to keep schools open. With that, I think we're ready to take some questions, and we might refer some of the questions to some of the talent we have in this room. Does anybody have any questions? Catherine.
Is anybody from the group kind of monitoring the potential of COVID-19 in our community, keeping track of those who have requested tests and have not received them?
So we're constantly in contact with healthcare providers, and those healthcare providers are monitoring those individuals. We are working to open up wherever we have the capacity to do that. We're going to open up the ability to do that. Cindy, do you want to come up and talk about how we're doing that and what the current status is, keeping in mind that's going to change day to day?
Yep.
Introduce yourself.
Perfect. I'm Cindy Spinelli. I'm the Communicable Disease Program Manager at the Health Department. And I did want to provide some clarity on the testing because I've read some news stories that were pretty misleading. The testing is not a screening test, so it's not valuable for people who may have been exposed and you're trying to figure out if you have it. The testing is a diagnostic test, so you need to have symptoms in order for the test to be appropriate. So I think if people understand that, that gives us a little bit more guidance in who should be tested.
I have definitely heard from people, though, who have felt sick and called in, which is part of the reason for that question, of folks who say that they don't feel well and they call into a provider and the provider says it doesn't reach that threshold at this point for a test.
So the testing, we need two parts. We need the symptoms, and then we also need an epidemiological link. So if one of those are missing, then it's hard for us to explain why we are using very limited resources on something that is going to have a very low diagnostic yield for us.
How many kits are there in the county, and do you feel like that's enough?
They're statewide, so it's not countywide. They go to the state lab in Helena. And so far it seems to be enough, and they're getting more. So we started out with 200, we're up to 600 now, and then adjustments in testing has allowed us to stretch the test even further. Yep.
I think we acknowledge that we all wish that we could do more testing. It's a problem that the supply of testing that's been available at the national level is a problem here, as is a problem anywhere else. I think healthcare providers, local health departments, and the state health department are doing the best to deal with that situation. I'm optimistic that testing will open up as time goes on, but right now we're making do with the best we have, which is the limited resources we have.
And so I'm sorry if this was answered and I just missed it. Is anybody keeping track of the number of people and who are calling in and requesting tests?
I don't know that we have a running tally for that, Catherine. I think what we're doing is we're communicating with healthcare providers on a regular basis. We really are asking healthcare providers to keep track of their patients, and as testing opens up, as that guidance opens up, we're able to communicate with those healthcare providers, and they can make contact with those individuals. Dion.
Do older people and people with pre-existing conditions get priority for testing?
Let's say Cindy answer that.
So it would all figure into each picture. If someone's in the hospital and we can't explain why they're having their respiratory symptoms, those folks are definitely eligible for testing. People who have big exposure, so like a known exposure to a case automatically get elevated. And then also our people who are over 60 are people that we're looking at too. So that's kind of how we're prioritizing, but there's so many different factors in it that there's not a quick and easy answer. We have to consider each on a case-by-case basis.
One thing we're trying to do is work with healthcare providers to rule out other possible causes of illness. And so that's where we're asking healthcare providers to do that influenza test, to do a respiratory screen, to make sure that we're testing people who are likely to have COVID-19 while we have limited tests available. Other questions? Yep.
The Bozeman School District has 7,000 children and hundreds of employees who are all about to go on spring break, many of them to other states, maybe some internationally, as you mentioned. What would it take to force a decision to close the schools? If one child is sick? Teacher is sick?
What it would take would be a determination that there would be number one, that there would be a reason to do it and a feasibility to do it. And the other thing it would take is that we would want to know that it would make a difference. And right now, we're not seeing any of those things meet that criteria. We are aware that people are going on spring break. I tried to provide some of the guidance that we're giving to people that are going on spring break. We do not have a current threshold for shutting down all schools. We are developing a plan in conjunction with the state, other health officers, and the superintendents to deal with exposure at one particular school, and that may involve short-term closures. We don't know exactly if that's going to happen, but we are putting those plans in place right now.
Can I add to that?
Sure.
Okay.
So CDC just released guidance last night on when to close schools and when to do it appropriately. So they rank communities by the transmission that's going on in the communities, either minimal, moderate, or sustained community transmission. And depending on what's going on in the communities, there's different guidance. So you may see a time where we close for a day or two to do very good epidemiological data gathering and clean the school and then open it back up. And that's based on studies that they looked at in 2 different cities where they closed down schools and didn't close down schools, and there was no difference. The social distancing, hand washing was much more effective.
Other questions?
How are first responders preparing as somebody who, if COVID-19 does reach our community, you'd be on the front lines of interacting with people. So how are first responders preparing to do that in a healthy way for those responders?
I think we've got some first responders here, and Dr. Lowe works with them pretty closely.
So Josh Waldo with the City of Bozeman. We get great direction first from our medical director. We get a daily update with the status of what's going on and any changes that we need to make in our precautions. We've already implemented additional screening by our dispatch system, so when people call in, if they hit certain questions the right way, they'll get additional follow-up questions, and that's just to give the first responders a heads up that you may need to take a higher level of precaution when you enter this residence. We have the PPE we need to protect our responders. We have a process in place to notify the hospital if we think we have a situation that we're bringing them. So from start to finish, from the dispatch center all the way to the emergency room, we're talking daily. We're updating our procedures as we need, and at this point, the communication is key amongst all of us.
Could you give an example of what that additional screening would look like?
Oh, sorry, I thought Dr. Lowe was behind me. It depends. It's symptoms. If you traveled out of the country to certain locations, those are the kind of the buzzwords or the keywords that our dispatchers are picking up on to ask you that next level of screening.
Again, as I alluded to earlier, a few weeks ago, we got a jump on this with a suspected case at that point, and right at that time, we put screening criteria in place at our 911 dispatch system, using the same criteria that we would use to decide on testing. So using this very similar criteria from the CDC, and we've been trying to update that to match what they're putting out for their recommendations.
And for the sheriff's office, we're a little bit different because we also have the jail. So this week, what we did was we had Cindy from the health department come and visit with our folks, get educated, and then have our medical staff there from our jail. And they've been talking, I think, on a daily basis. And then what we've done is our medical staff are going around and training all of our patrol deputies and every single one of our detention officers to ensure that we are prepared. And I will tell you, honestly, after we meet with these folks and we get educated, we are a lot more comfortable and confident. And that's the important thing. As far as the jail, I've had questions about, is the jail shutting down? Absolutely not. We are open for business, and we will continue to be open for business, and our patrol function will also always be working and out there. Public safety is always number one, period. So I just want to make sure that the public understands that. Thank you.
Is time inmates get to spend together for like recreational, is that being cut down at all or any?
No, and I'll tell you, for those of you that have been in our detention center, that's probably one of the cleanest, most sanitized buildings in this county. Dion.
Have you guys had talks about shutting down the Law and Justice Center? You know, it's a high traffic area and people are coming in every day.
We have not, but I will tell you, and this is another thing that the community needs to understand, is even though this is a new virus, this collaboration right here behind you is not new. We work together every day. So I hope the community understands and feels good about that. This is just another obstacle, but if something does come up, we feel very comfortable to make that phone call and we get the right answers from the smart people. So.
You good, Steve?
I think they covered it.
Okay. Other questions?
Sorry if I missed this. How many people have been tested in Gallatin County for?
I don't know the number in Gallatin County off the top of my head. I know there's been running up to about 50 people have been tested in the state of Montana, and they've all been negative so far. We can get you that number later on, though, if you want.
So when talking about medical supplies, obviously there's a shortage for some medical supplies at this point. Who does it fall to make sure that there are enough supplies in Gallatin County? Is that provider to provider, the state, local county health? It's really a mix, and if somebody from Bozeman Health wants to talk about the challenges that creates, but it really is up to the healthcare providers. That's a challenge right now. That's a challenge. All healthcare providers are seeking some of those supplies, not just face masks. So I don't know if somebody from Bozeman Health wanted to address that.
My name is Bergen Knopf. I'm the System Director of Clinical Practice at Bozeman Health.